Hi, my name's Ted O'Connell, one of the authors of USMLE Step 3 Secrets. This is case 5 in our CCS cases. Please take a look at medicalschoolvideos.com for additional videos and like us on Facebook. Let's get started with this case. History of the present illness. A 5-year-old female is brought to the pediatrician by her father. Her parents have noticed that her gums have been bleeding a small amount when they brush her teeth. They have also noticed small purple dots that have appeared on her ankles. She has been acting normally and does not appear bothered by the skin changes. She has always been a healthy child, though she does occasionally have viral respiratory infections. She had symptoms of an upper respiratory infection approximately 2 weeks ago. Vital signs. Temperature is 36.8 degrees Celsius, pulse is 80, blood pressure 100/70, and respiratory rate is 20. Additional history. There's no other medical history, and vaccinations are up to date. What is a differential diagnosis? The differential diagnosis includes immune thrombocytopenic purpura, or ITP, hemolytic uremic syndrome, or HUS, thrombotic thrombocytopenic purpura, or TTP, drug-induced thrombocytopenia, and leukemia. What components of the physical exam do you perform? The components of the physical exam that should be performed include general appearance, HEENT, skin and lymph exams, cardiovascular, lungs, abdomen, and neuropsych. Physical exam findings. General, the patient is in no acute distress. HEENT is within normal limits. Skin and lymph reveals scattered petechiae over bilateral lower extremities with no lymphadenopathy. Cardiovascular and lungs within normal limits. Abdomen within normal limits with no splenomegaly. Neuro and psych are within normal limits. What are your initial orders in this case? Initial orders should include CBC, peripheral smear, Chem 14, PT, and PTT. Advance the clock, and the test results that come back include a platelet count of 28,000 with all other studies within normal limits. What are your follow-up orders? Follow-up orders should include prednisolone orally, as well as repeating the CBC in 5 days with follow-up in 5 days and 2 weeks. Advance the clock. At 2 weeks, the patient's platelet count has normalized and her symptoms have resolved. What are the critical actions in this case? Critical actions include skin exam, lymph node exam, abdominal exam, CBC, peripheral smear, and consideration of steroids. Let's discuss this case in more detail. Immune thrombocytopenic purpura, or ITP, is a condition characterized by platelet counts less than 100,000 and symptoms of thrombocytopenia, such as petechiae, bruising, and bleeding. This condition can range from mild asymptomatic thrombocytopenia to severe life-threatening hemorrhage, including intracranial hemorrhage. In children, ITP is most common between the ages of 2 and 5 years. It tends to be acute in onset and resolves spontaneously or with steroids. It is often preceded by a viral infection during the previous month. In adults, ITP tends to be more indolent. It occurs over a long period of time and is more refractory to treatment. A careful history and physical can elicit concerns for thrombocytopenia, and a CBC can quickly provide platelet count. Once thrombocytopenia is established as a diagnosis, other causes should be evaluated. A normal peripheral smear helps rule out TTP. In patients at risk, infectious causes should be evaluated, including HIV and Helicobacter pylori infection. The size of the spleen should be evaluated at least with a physical exam, and any suspicion for splenomegaly warrants advanced imaging. Any offending agents should be stopped if possible. Common offenders include antihistamines, proton pump inhibitors, and sulfa drugs. Children with mild manifestations can usually be monitored as an outpatient and do not need treatment. Moderate cases can be treated with steroids alone. Severe cases require steroids, intravenous immunoglobulin, platelet transfusion, and hematology consultation. Refractory cases may benefit from splenectomy. A bone marrow biopsy is indicated in patients who are refractory to treatment and those in whom there is concern for malignancy. For example, if there is lymphadenopathy, weight loss, or atypical cells present on the peripheral smear. That's the end of this discussion of ITP. Please take a look at our other videos as well. Thank you.